to check my understanding, the first A is for alertness, and this is about looking at how drowsy or how agitated somebody might be, and that item in the 480 is instructing the observer or the assessor to use their observational clinical skills to do that, and to then respond on a 0 to 4 rating scale. But I just want to check, my understanding is that that is reverse scored. So we would need to give a 0 score for normal and a score of 4 where things are clearly abnormal.
That's right.
Can you maybe just talk us through, from your perspective, what would you be looking for if you were observing a patient for that item, and how you would score that?
Yeah. So as you said, Lynn, exactly, it is reverse scoring. So obviously, ideally, we want the patient to have a score of 0 and a score of 4 if there's something out of normal here. So if the patient has absolutely no problems with their level of alertness, they should be able to keep eye contact with you and engage in a conversation with you as well without being overly sleepy or sedated or kind of unduly agitated either. And for those patients who have no problems with their thinking or their memory, they should be able to state their name and address as well. And that would also indicate that they are orientated to their environment and what's going on.
Okay, so what would you do, or what should staff do if the person is actually asleep? Because, you know, as you know, people recovering from orthopaedic surgery are often really tired and drowsy. They're often on strong doses of pain medication. So, you know, what happens if you approach patients and they are actually asleep?
Yeah, so the 480 is actually quite handy because you can still complete it even if the person is asleep. Ideally, you want to try and wake them up. And as per instructions, it basically would be by talking to them, so you can call their name or gently touch them on the shoulder. And when they wake up, sometimes they might be slightly disorientated. And again, that's coming back to what you've already said, Lynn, especially if they are on medication, strong medication for pain. So because of that, they might be quite slow to respond to you. But if this only lasts for a few seconds and then they can kind of reorientate themselves and engage in a conversation with you, they would only be rated as mildly, showing mild level of sleepiness on 480, and that's still a score of 0.
Okay, so if that's a score of 0, what kind of thing would you be looking for in order to get a score of 4, as somebody displaying a sort of clearly abnormal level of alertness? What would that be indicative of?
Yeah, so that's quite an important question here, because a clearly abnormal level of alertness usually indicates delirium. So that's why it's automatically scored as 4 on the 480. So that's the highest score you can get. And significant changes in your alertness can basically be shown in a number of ways.
Such as what sort of things?
So you have, on one end, you have patients who might be you might not be able to wake them up at all. Or if they wake up, they might just open their eyes very briefly and then go back to sleep. Or they might open their eyes but not really acknowledge you or look at you, even though you're trying your hard to get their attention. Or they might just be quite unfocused and drowsy and only just give you very brief or slow or infrequent answers. So, and that's to the point where you actually cannot have any sort of meaningful conversation with them.
So what would that be typical of? And is there a particular type of delirium that would be a big clue about?
Yeah, so this would typically be seen in what's called a hypoactive delirium.
So hypoactive delirium is about the kind of very drowsy and difficult to rouse end of that continuum.
Yeah, that's right.
Okay, so what would you be seeing if somebody wasn't experiencing a hypoactive delirium, but they were experiencing something else, a hyperactive delirium, what would be the clues, or what would be the kind of clinical indications that you'd be looking for in that presentation?
Yes, so that's a good question as well. So at the other extreme, you have patients who seem quite agitated or fidgety, restless when you speak to them. And that's exactly what you would expect in more kind of hyperactive delirium type of presentations. So some of those patients might even try to get out of their bed or pull on their lines or even act quite aggressively towards those who approach them.
So that's almost feeling like that would be a wee bit more obvious to staff, because it's more, I don't know, possibly even some challenging behavior, or what might be similar to some challenging behaviors that staff might be more aware of.
Yeah, no, definitely. So a lot of the time when delirium is diagnosed in hospitals, it's usually because of those kind of disruptive type of behaviors. And a lot of the patients with hypoactive delirium, so the ones who are drowsy and not really doing much, not really engaging, they are actually at risk of not being diagnosed, or the diagnosis being made quite late just because it's not as obvious.
Okay, so the hypoactive could be confused with the person just being very quiet or sleepy or sedated,
Exactly.
and being a wee bit more likely to be missed, whereas the hyperactive, there's more activity, there's more agitation, it's more obvious almost.
Definitely, it's more obvious, and sometimes it's very hard to know why the patient might be hyperactive, what's going on. So what might be useful for staff is to look for some clues again. So sometimes patients with hyperactive delirium, they might be seeing things in their environment, so sort of hallucination-like experiences. And that can be causing a lot of the agitation, or trying to get out of the bed, or, like pulling on things, or acting aggressively. So what might be useful sometimes to do is just to look at the patient's eyes, just to see if they are maybe wandering around the environment, kind of if the patient is maybe fixating on something on the ceiling or on the floor, or following something with their eyes, or whether they are kind of looking past you, sort of like in the distance, and quite intently looking at something that's obviously not there. And that's because visual hallucinations are quite common in delirium. So about 1 in 4 patients with delirium would experience them.
Okay, that's really helpful. So just to summarize this first item, a clearly abnormal level of alertness would be either a patient who's very drowsy, appearing very kind of difficult to rouse, unable to be woken easily, or at the other extreme, somebody who's very agitated, sometimes to the point of acting possibly even in an aggressive way towards you, a more obvious type of what might be conceptualized as a kind of challenging behavior or challenging presentation.
Yeah, exactly. And basically, either of those presentations would be scored as 4 if this is not normal for the patient, which probably wouldn't be normal. So on the form, you would just put a score of 4.